the vertebrae body is small in cervical vertebrae. Here is the vertebral foramen. It's large and triangular. You can see this is triangular in shape. The spinous process is short and bifiid from C2, from C3 to C5. It's become longer in C6 and C7. C means cervical. Yeah. There are two transverse processes. And we can see they are transverse foramen in transverse process. It's only present in cervical vertebrae. We cannot see it in thoracic vertebrae or lumbar vertebrae. It's special, only present in cervical vertebrae. Okay. Sorry. Where is the error? Okay. The articular process, we can see the surface articular facet of the articular here. This is the superior articular facet. It's relatively horizontal. The atlas is the first one, cervical vertebrae. It had no vertebrae body. We can see here is the anterior arch and the posterior arch, two less mesh. It's spinal. We cannot see the spinous process. They no. It can see. This is the anterior. Here is the posterior arch, left and right. Lateral meshes. There is a dental foray. It's accommodating the depth of the second cervical. Sorry. Here is the dental foray at the middle of the posterior surface of anterior arch. We can see the groove for the vertebral artery. The vertebral, we can see here, is the groove for the vertebral artery. Vertebral artery passes through this foramen, the transverse foramen. Okay. Axis. Axis is distinguished by its dance. We can see. This is the dance. With articular with the dance foramen of the atlas, we can see here is the dental foramen. Here is the dental foramen. It's articular. It's with this dance of the axis. This is the second cervical vertebrae, C2. Sorry, C2. There is a dance. We can see this is the C1. This is the dance of the C2. This is the C2. It's a dance. This anterior arch articular is with this dance of the C2. Is that clear? The C7, also called vertebral prominence, it contains a very long and non-bifid spinous process. You can see its process is spinous process is very long. It's the longest spinous process in these 7 cervical vertebrae. It is visible with neck flex. It can be used as the landmark in counting cervical and thoracic spinous process. Thoracic vertebrae. It is heart-shaped. There is this superior, and in cervical and lumbar vertebrae. It is the causal way allow us to distinguish the thoracic vertebrae from cervical or lumbar vertebrae. It's special. Is that clear? Because this causal way can articulate with the ribs. They can form thoracic cage. Only thoracic vertebrae has causal way. Is that clear? Only thoracic vertebrae. The vertebral foramen is smaller and rounder. It has 3 processes we can see. This is spinous process, transverse process, superior and inferior articular surface, the superior and inferior process. We can see its spinous process projects obliquely downwards, backwards and downwards obliquely. Here is the anterior, posterior. We can see it projects obliquely downward. The articular process, this, here. Vertebrae body, lumbar vertebrae, it had a large and kidney-shaped vertebrae body. You can see. It's larger and kidney-shaped. Here is the foramen. Vertebral foramen is large and triangular in shape. Its spinous process is strong and short, squared and project horizontally. We can see it projects horizontally. We can see the thoracic, its process obliquely downwards. Here we can see the process. This is the thoracic, the spinous process of thoracic vertebrae. Here is the lumbar. This is the spinous process of lumbar vertebrae. We can see it projects horizontally. This is obliquely downward. Is that clear? The spinal process. Okay. The transverse process. Here is the transverse process. Is almost the articular forces of the articular process are almost sagittal. In this direction, we can see here is the articular facet of the articular process. You can see it's almost sagittal. Let's take a look at the articular facet of the thoracic vertebrae. It's almost, you can see here, it's almost coronal. Also coronary, okay, you can see. From side to side, this is the facet of the articular process. You can see. These surfaces are in the plane, coronary plane.